At this time, we'll turn to Brian Gottschall. Brian is the director of the Berks County Department of Emergency Services and the lead for the Berks County COVID-19 leadership team, and he'll be providing the Berks County COVID-19 data report. Brian?
Good morning, Commissioners. Slightly longer report than the last few weeks, but we'll attempt to keep it terse. Taking a look at our our smooth 14-day cases, we continue to see a drop, not as precipitous as it had been over the last couple of weeks. And of course, we want to see that line going vertically down, but we are seeing it start to plateau out into a kind of new place of comfortableness. And we'll talk a little bit more about what that might mean later on. At a nationwide level, we are starting to see a number of counties move from that red to the various other colors. Again, we see CDC having a little bit of a problem calculating percentages, so we wouldn't get focused on that in the chart. But the middle column is important. We see that we're now down to about 85% of counties in the nation still being in high transmissibility. And just as a reminder, about 3 to 4 weeks ago, that number was, I believe, 99.8%. So we are seeing improvements as we start to roll out those high case days. With respect to our local hospitals, continued good news. I mean, we've seen an uptick in the numbers here from last week to this week at Tower, but I certainly don't think that's a significantly or a statistically significant uptick, and it still represents where we have been. St. Joe's, folks will recall, for a number of weeks we weren't able to get local data from St. Joe's. In fact, as of last week, they have now ceased to publish their cases to a public dashboard throughout the entire Penn State system. So really only Tower numbers will be available locally for the public to consume at this point in time. Please recall that we got rid of this slide a number of weeks ago as we saw this downturn over a period of weeks and mentioned that we would bring it back if the need dictated. We've now seen a hook in those numbers and an upward rise again. And you'll take note that the red line representing this year's flu season has a very different shape than any other shape that we've seen in prior years. So we did indicate to the public that we would bring this slide back if there was something noteworthy, felt that this was noteworthy this week, and brought it back for the public to be aware of, that we are seeing that uphook in flu cases. On the current events on the horizon, this is the one where I said we do have a little bit we want to talk about. Wrapping up the under 5 Pfizer vaccine, we've now gotten information that this will come back to the table in April after some further studies are completed and there's additional data for the manufacturer and FDA to consider. On the Omicron BA.2 subvariant, we've seen that for the last couple of weeks, this has been a growing percentage of cases. As of this week, according to CDC Nowcast data, we're at between 3 and 7.3% of the sequence cases in our Health and Human Services region, so in our multi-state federal HHS region, are now this Omicron BA.2. Some additional information has come out over the last week that's kind of firming up what we know about this variant. We're now looking at about a 30 to 40% increased transmissibility versus Omicron B1. And real big information, we've been talking for the last couple of weeks about wanting to know what having had B1 meant to the possibility of getting BA2. And there's a Danish study that's in preprint that's referenced there at the bottom for folks that want to go back and look at it directly. But what that Danish study has indicated is that the possibility of contracting BA2 after a B1 infection does exist, although in the eyes of the study authors, it's a rare occurrence. And I'm a little confused by that, to be honest with you, because there was an N of about 150 cases looked at in this study, and about 45 of those cases were reinfections of BA2 after B1. So I'm not quite sure how 33% is rare, but that's the phrase that these study authors used in wrapping up their study. And then the last thing that the folks might want to look at is the South African curve of Omicron. And of course, we know that South Africa was the focal point of Omicron from the beginning, and therefore it's something that we can look at, although the demographics of South Africa are very different than the United States. But what we've seen in South Africa is that the BA2 curve has risen up to match the downslope of the B1 curve. So said another way, we're not seeing like a big explosion of BA2 like we did B1. What we've seen is that curve rising up to meet the downward curve of B1. And what that's resulted in then is kind of a flattening out and a plateau of cases, which may be what we're starting to see here locally. Just very quickly to go back to our first case slide, we see this starting to flatten out, and we'll only understand more about that in future weeks. And I would encourage the folks to keep an eye on that and look at it. Just a reminder to everybody, we are doing drive-up testing here outside of DES at 2561 Burnville Road. We've gotten a commitment from DOH to extend that now through April 2nd. So the ongoing schedule will continue through April 2nd. And reminding everyone to please enter the site off of the Van Reed Road access side of the parking lot. The last thing we want to mention about current events is the Berks Cares Vaccine Center. As we've seen a decline in community need or desire for COVID vaccine, we want to make sure that we're working with Penn State to appropriately deploy their resources in a way that's as efficient as possible. And based on taking a look at a number of weeks of appointments, the decision has now been made that beginning March 5th, the center will operate only on Saturday mornings from 9 a.m. to 12 p.m. And folks can continue to register for vaccine at that center by going to Penn State Health's website. The link is there. A little hard to remember, so the easy thing to do is, as always, go to doyourpartberks.com, where then you can link out to that site to register for vaccine. Normally, that would be the end of our report, Commissioners, but we want to make one more mention that as of this week, we're going to end or at least create a hiatus in the weekly public data reports. We want to let the public know that we're going to continue to monitor this stuff behind the scenes at a community, national, and world level. We're going to maintain a continuous aggregation of this periodic data so that if we do need to bring it back and show it to the public, we can make it available without a break in the continuity. And let everyone know that the commissioners are committed that if the public data report, if the change in data warrants a return to the public data report, we're going to bring that back for the public so they can be advised and keep on top of these types of things. With that, Commissioner, I'm back to you guys.
Thank you very much, Brian, and thank you especially for continuing to lead and manage these weekly reports. I know it takes a significant amount of time and effort, but we very much appreciate you providing the data. And as noted, we will take a hiatus. Hopefully, we won't have to bring these COVID-19 data reports back. But if we need to, we'll address it at that time. Any other comments from my colleagues? Okay,